Hi guys, good morning and welcome to the podcast. My name is Andy. I'm the clinical lead here at ReadyCare and the guy behind all the kind of nutritional and physiological science that goes into these webinars and our publications as well as our clinical trials. Thanks for joining me. This morning is going to be a real specific topic that's going to get a little bit technical because essentially here we're talking about hormones, we're talking about biology and physiology. But if you have polycystic ovarian syndrome, this one is going to be gold for you because the research is beyond clear in terms of what's the most effective strategy you can put into place for reversing polycystic ovarian syndrome. And it ain't medications, I promise you that. It's not metformin, it's not clomiphene citrate, it is something else. So what I'm going to do is I'm going to share a couple of slides in a second, these guys here. First of all, I'm just going to talk about what is polycystic ovarian syndrome. Well, straight off the bat, polycystic ovarian syndrome, or PCOS for short. And just to break down that term as well, because it's really long and you think, geez, that's very complicated. Poly meaning many, cystic meaning cysts, ovarian in your ovaries, syndrome, a syndrome or a cluster of occurrences. So polycystic ovarian syndrome refers to cysts on your ovaries, but it doesn't have to be just cysts on your ovaries. It can also be high levels of male hormones. It can also be lack of ovulation or sporadic ovulation. So this will be an incredibly interesting webinar or talk. And please absorb this and take it in, because if you have PCOS, if you know anyone with PCOS, this is going to be absolutely gold, like incredible information for you. Now, the reason I say this is I've quite a bit of clinical experience working with PCOS. I've done a lot of research on it, and we have successfully treated PCOS in quite a few females. I'll show you the case studies at the end, but we've had females who hadn't ovulated or had a regular period in 3 or 4 years, change their diet and their lifestyle, and within 6 to 8 weeks, they fell pregnant. I mean, it's remarkably effective, remarkably effective. So let's get into it. Bear with me. My background is health science, so I can get a little bit sciencey, but I just want to be very thorough in how I'm explaining what exactly PCOS is, what the main driver of PCOS is, and then how we can pull back and reverse engineer that and change our diets to reverse polycystic ovarian syndrome. And we'll have a couple of questions as well. If anyone has questions, please pop them in either as we go along or towards the end. Right, let's get started. So PCOS is basically a cluster of conditions or occurrences in the female body. And if you meet 2 of the 3 criteria, if you have 2 or the 3 of the things you see in the circles here, we call that PCOS. So these are fancy words, but I'll explain what they mean. Hyperandrogenism. And androgenism, like androgen, means male hormones. So think testosterone. Hyper means high. So basically, hyperandrogenism is a broad term for high male hormones, but more specifically, testosterone is usually high. Oligo and ovulation means little or no ovulation. So anovulation means the absence of ovulation, so you're not ovulating. And oligo means sporadic, so it's kind of coming and going. And then polycystic ovaries, which are diagnosed, would have to be diagnosed by an ultrasound. So broadly speaking, there's a couple of different what we call presentations of pathologies when it comes to PCOS. But broadly speaking, you'll see at least 2 of these together, and more often than not, you'll actually see 3 as well, which is known as Frank's presentation, a Frank presentation of PCOS. You'll see the cysts on the ovaries, lack of ovulation or sporadic ovulation, and high levels of male hormones. So you'll see that in stuff like excessive male pattern, maybe male pattern baldness. You might see it in excessive hair growth, acne, unwanted hair growth, and so on. So if you have 2 out of the 3 of these, broadly speaking, you will have PCOS, and usually it's diagnosed by an ultrasound. So if we look at the 3 causes, right, so I'm going to break down what causes the 3 different things: the high levels of male hormones, the lack of ovulation, and the polycystic ovaries, or the cysts on the ovaries themselves. Okay, so the first one, hyperandrogenism, high levels of male hormones. So hyperandrogen, or high androgens. Again, high testosterone, really. We'll focus on testosterone for this one. So we know what causes a state of excessive male hormones. So it can be like real rare stuff like genetic defects. It can even be, a tumor in the wrong place causing an imbalance between progesterone and testosterone. But it tends not to be. It tends to be the vast majority of the time high levels of insulin. Now, You're going to see this word a lot during this presentation. Insulin is the hormone that your body produces when you eat carbohydrate and or sugar. And carbs and sugar, for all intents and purposes, are roughly the same thing. 2 slices of bread is roughly the same thing as 8 spoons of sugar. If it's brown bread, it's roughly the same thing as 7.2 spoons of sugar, and so on. Bananas, potatoes, cereals, porridge, all that sort of stuff. The stuff for the longest time we thought would help us lose weight. Look around, it didn't work. As a nation in the Western world, it's been a disastrous experiment telling people to eat low fat, high carb and count their calories. So those sort of foods, the high carb, refined carbohydrates and sugars, in order for your body to deal with glucose, which is what carbohydrate breaks down to, your pancreas secretes a hormone called insulin. And this is important. Your body requires insulin for hundreds of different physiological reasons, but excessive insulin causes a range of problems around the body, from high blood pressure to weight around the midsection to fatty liver, type 2 diabetes, heart disease, and many people would argue most cancers. So that's important to know. So if we look at what insulin does in PCOS, high insulin leads to suppression of a hormone, and this is where I want you to bear with me for a second from the sciencey sort of stuff, called SHBG, which stands for sex hormone binding globulin. So globulin is just a protein, sex hormone, think testosterone, think binding it up and keeping it at appropriate levels in the female body. So if your insulin levels are high, if you're eating a lot of sugar and carbs, it's going to increase insulin, which in turn is going to drive down the protein or the binding element that keeps testosterone at appropriate levels in the female body. This is very well understood. I have the reference down below here as well. There's loads of references for this. So if your insulin levels are high, and typically you'll see this with weight around the midsection, your blood pressure might go up a little bit. You might have been told your blood sugars are a little bit high. You'll always be hungry. Your energy levels are up and down. They're the broad kind of presentations of someone with high insulin. If insulin is high, it drives down sex hormone binding globulin, which means your body can't function the way it should in terms of suppressing testosterone. So you get high testosterone, it's in particular free testosterone, which shouldn't be high in females. Females do require some testosterone, but not much. And then you get masculizing features. You see the same thing in females who take testosterone to promote muscle growth, because it is an anabolic or muscle building hormone. So you see the acne on the back, on the face, maybe a little bit, unwanted hair growth, maybe on the face or on the forearms, stuff like that, or in areas that you wouldn't usually see it in females. So you get mascularizing, why can't I pronounce that word, features. So your hormone levels will be at a point that would be similar to that of someone who is male. And the root cause of this are high levels of insulin. So a very, very easy fix for this, and we see it all the time, is lower your intake of carbohydrate and sugar, and this can go back to normal. And when I say this can go back to normal, I mean the reduction is off the charts. You can see a 50, 60, 70% reduction in your testosterone level in 4 to 6 weeks. Now, the anovulation that happens is a knock-on effect of your insulin levels being high. So basically, I won't go into the science on this too much because it is a bit heavy, but typically what happens in the pre-ovulatory stage when a female is about to ovulate is that your follicle should develop up to about 9.5 millimoles. Excuse me, I drank coffee just before I came on, and for some reason it's causing a bit of gas. So it would usually at 9.5, it would have an appropriate response to a hormone called luteinizing hormone. And then you get the pre-ovulatory follicle and you ovulate. Where insulin is high, you get up to about 4, and if it goes up to about 4.5 or 5, you get a kind of a premature responsiveness to luteinizing hormone, and you can't ovulate. And again, the cause of this is high levels of insulin, so refined carbohydrates and sugar in the diet. So again, reverse engineer this, and you can go back ovulating. And I'll show you the case studies in a second. They're actually quite remarkable. And the reason then, this is another knock-on effect of high insulin, the reason that you get the cysts in the first place is that usually you would ovulate, the bubble would kind of burst and you'd be done, and it goes in this kind of cyclical fashion. But if development stops, you get loads of these kind of immature follicles that were supposed to develop but didn't inside in the ovary. And essentially what happens is they get packed up, and that causes a lot of friction and leads to the cysts. That's why you're seeing the cysts. So essentially it's just dysfunction. The ovary is not producing follicles like they should, they're not being released like they should, and they're building up and causing this kind of sardine effect, and that's leading to the cysts. So how do we treat this? And I mean, it's crazy. If we look at the medical way of treating polycystic ovarian syndrome, they got something right in the sense that if you're not ovulating, they understand, the medical model understands that if you suppress your blood sugar levels, if you get your blood sugar levels down a bit, it will help with ovulation. And it'll help a little bit. So they use diabetic medications like metformin to lower your blood sugar levels instead of actually eating less sugar, which is madness. They use medications which promote fertility, which are the likes of clomiphene citrate. Again, this is for the most part completely unnecessary. And worst case scenario, if nothing is happening, they'll use IVF, which is, as I'm sure if you're experiencing PCOS, you know, extremely expensive and not always all that successful. Often takes 4, 5, 6 rounds to conceive. In terms of the hyperandrogenism, the high male hormones, what do we do there? Do we look at the root cause and say we should lower insulin? No. Laser removal, use a medicated cream, bleaching. In terms of the polycystic ovaries themselves, instead of, you know, do we ask the question, well, why are the cysts there in the first place? Is it something in your lifestyle? No, we don't. We just drill into them, remove parts of them. Laparoscopic ovarian drilling, which is just drilling a hole in the ovaries so that you get kind of basically a fresh part. You're removing part of it. And something called wedging, where you literally cut out like a 20-30% of the ovary and allow the rest of it to grow back in, which isn't insulin resistant or hasn't been removed by high sugar levels. This is all madness because lifestyle therapy is a class 1 indication for PCOS. It's the first thing you're supposed to do for it. Yet the current, what we call allopathic or one-way medical model just says medicate and surgery, which are, they're lucrative, but definitely not the right way to do it. So let me show you a couple of case studies here, and then we'll talk about what changes you should make in your diet if you do have PCOS. This is a typical kind of PCOS patient. Broadly speaking, if you have high blood sugar levels and you have high insulin levels, which is what causes PCOS, broadly speaking, you'll be overweight. That's a generic statement. It's not always the case. So this lady was 32 years of age. She was obese. She had prediabetes, PCOS on ultrasound, and hadn't ovulated in about 5 years. So she had IVF, 3 rounds of IVF over 5 years, which cost her about 40 grand. And she had a prescription for clomiphene citrate and metformin. So all of the stuff I talked about in the previous slides. She was on our program for polycystic ovarian syndrome, which is like a 12-week program where we coach people every week. 8 weeks in, she had lost 19 pounds. She went and got a scan done. It showed an 80% reduction in the size of her cysts. And at the same time, a couple of weeks later, she actually fell pregnant, which is just incredible. And you look at this and you think, well, that sounds just too good to be true. But it's basic physiology. If you really understand the physiology, this is what you would expect to happen. Now, I'll balance this off with actually a funny story on that one. So this lady had come in, and about 2.5 months before we had, before this happened, before she fell pregnant, she come in to do her consultation. So this is about 10 weeks prior to her falling pregnant. And she sat in the chair and she actually got upset because she so badly wanted to conceive. I think she was, oh, it says it there, sorry, 32. I was going to say, I think she was kind of early 30s. And I remember getting very upset, and I could see how badly she wanted to conceive. And she was just, she was upside down trying to get around to it. And she thought she might never be able to have kids and got very upset in the consultation. Talked about how much she wanted it. And I was coaching her, and I remember about 4 weeks in, she'd lost 19 pounds or 5 or 6 weeks in, and literally just fell off and stopped returning my calls, stopped returning my texts, asked her, did she want to book a follow-up appointment? And then she entered a weight on my fitness pal, which was up 5 pounds. And I never get annoyed with patients, but I just thought, geez, you wanted it so much. You've lost 19 pounds and now you've put 5 back on. Like, this is, commit to it for a couple of months and see what happens at least. So she just said, look, I'll see you next Tuesday or next Wednesday. And of course, lo and behold, the 5 pounds was because she was pregnant. She came in the following Tuesday or Wednesday and told me. So incredible. Now, this is a really interesting stat, is that 30 to 50% of PCOS sufferers are a normal weight. What's interesting is by BMI, so by their total weight, and BMI is kind of a nonsense metric because it's just height over weight squared. My BMI, I'm a little bit overweight because I hold a bit of muscle mass. But then if you look at waist to height ratio, I'm in the healthy category. I think body fat is, I don't know, 10 or 11%, something like that. So if you're just looking at a weight number, BMI is not all that accurate, particularly if you're holding any bit of muscle mass. But by BMI, 30+% of females with PCOS are normal weight. What's really interesting is if you look at the waist to height ratio, are they carrying weight around the midsection? The vast majority of PCOS sufferers are carrying weight around the midsection, even if they're normal weight. And that's important to know. So this lady was 34. She had a normal weight. She was a BMI of 20, which means her weight was somewhere around 8 to 9.5 stone. She was diagnosed by ultrasound. She had pre-type 2 as well, hadn't ovulated in 3 years. And pre-type 2 actually is, you don't always see it, we just happen to see it in these two case studies. 80% of the time you won't see it. Hadn't ovulated in 3 years, had a prescription for clomiphene citrate. 2 months on ready care control, she lost 1 pound. This is really important to note. You don't have to lose weight to reverse pre-diabetes or polycystic ovarian syndrome. So she had reversed her pre-diabetes and reversed polycystic ovarian syndrome because we kept her sugar and carbohydrate level low, but we increased her protein and her fats. I told her, eat as much as you want, just avoid carbs and sugar for the most part. Started ovulating again about 2.5 months in, and month 3 fell pregnant as well. And that's just a nice quote at the end there from her. So this is something we're quite passionate about, actually, is PCOS. The physiology is very clear to see. For the vast majority of people, PCOS is a manifestation of high blood sugar levels causing high insulin levels. If you lower your blood sugar levels, your insulin levels come down, and the anovulation, the hyperandrogenism or high male hormones, and the polycystic, the cysts on the ovaries themselves will often, not always, but will often resolve. So guys, if anyone has any questions, please pop them in now. I'm aware that most people watch this on the replay, but if anyone does have any questions who's watching it live, please do pop them in, or even if you have a comment about the content. So polycystic ovarian syndrome. Oh, I'm sorry, I wanted to show you one more thing, excuse me. This is the what the hell do we do about it slide. So ignore the fact that I'm talking about NAFLD, non-alcoholic fatty liver disease. Same thing for PCOS. If you want to treat PCOS, reduce vastly or eliminate breads, rice, pasta, breakfast cereals, cakes, and starchy vegetables from your diet. So move towards a lower carb or even ketogenic diet with intermittent fasting. That would be my my advice to you. So bread, rice, pasta, breakfast cereals, high sugar foods, cakes, and pastries. Eliminate them from your diet, or at the very least, vastly reduce your intake of them, and move towards a lower carb or keto diet, ketogenic diet, which is very low carb, high in kind of healthy fat and protein, which would consist of meats and eggs and fish, seafood, stir fries without rice or noodles, avocados, olive oil, chia seeds, dark chocolate, real butter, green vegetables, and full fat cheese. So this is known as a ketogenic diet. Now, interestingly, because of the hormonal effects of a ketogenic diet, it does exactly the opposite for males compared to what it does for females. And I know this only too well because my doctor wanted me to have investigations because he said he hadn't seen a testosterone level as high. And I'm not saying that in a boasting way, but if you lower your insulin levels, and particularly when your body's running on ketones, which are fats, ketones and cholesterol itself are a precursor for testosterone in males, meaning the higher your ketone level, the higher your testosterone. And a normal range would be kind of around 500, and mine was 1,200. And he had said to me, look, I think you might have some sort of tumor. I've never seen it this high. And I said to him, no. So I went through all the signs with him and just said, this is normal. And he said, this is literally above what you would see in like an 18-year-old, which testosterone levels tend to decline in men because we get unhealthier and overweight as we get older, but they don't have to. And then conversely, in females, it does exactly the opposite. So in females, it appropriately lowers testosterone. Insulin levels going down in males cause your testosterone levels to go up. Insulin levels going down in female cause your testosterone levels to go down. So it'll optimize hormones, but in totally different ways in males and females. So that's important to note. So the ultimate fertility tool for both males and females, if you want to optimize hormones, is a ketogenic diet, intermittent fasting, and another way, actually, if you do have, if there's a male partner that you're listening for as well, and you have fertility issues, ice baths, cold water exposure. Get them to look into cold water exposures, jumping into an ice bath for 2 to 5 minutes, 3 to 4 times a week, like massively improves your or balloons up your testosterone level. Like I'm talking 20 to 40% in kind of 4 or 5 weeks. That's it for me, guys. Any questions, pop them in. Otherwise, we'll wrap up in a second. We will be back next week. I think it's Chloe is on next week. Let me just check the title of her talk next week. So she's back next week with improving relationships through brain-based something or another. All sorts of complicated, but like really interesting kind of neuroscience. So Chloe's brilliant. So do make sure and tune in for her neuroscience-based stuff. Guys, thank you so much for your time. Really appreciate you being here with me. Please feel free to share this and pass it on to anyone with polycystic ovarian syndrome. And if anyone is interested in our one-to-one coaching program as well that we do, just let us know. Just reach out and let us know. Appreciate you guys. Thank you so much for joining me, and I'll see you soon. Take care, everyone. Bye-bye.